Tell us about your role in the advisory board in this conference.
So I've had the pleasure of being on the advisory board for a number of years now, and one of the things in those discussions you find is there's a lot of the same things keep coming up, and I think this forum is a really good one to bring people together to begin talking about some of the challenges of our industry, and now even more so with economic pressures and with all kinds of mergers and acquisitions and talent shifting from pharma to to CRO and sometimes back again. We've got to really innovate the way we're going about conducting clinical trials and working together to do so, because we are needing to become more efficient. The economic pressures, I think, have just forced that even more so. So it's helping drive us in that direction. So some of the topics that I spoke to today are around how we might be able to do so through the use of metrics to help better streamline how we measure performance and communicate with each other, but also to help standardization or consistency. So we build in efficiency where there is a repeatable process, where there isn't something that is proprietary. And we help advance the industry to be able to bring the drugs to market not only faster, but at a lower cost, so that that innovation translates into something available for the population that needs it in order to treat their illness.
You're speaking on another topic tomorrow. What are some of the other concepts that you're going to be speaking about and highlighting to the attendees?
So that's addressing really, is there a difference and what are the differences when a CRO or other service provider actually engages with a small pharma company or a biotech company? And is it the same? Are there different ways that there should be partnering activities as a result of the size of the organization, and the concerns on those smaller organizations about whether or not they get the attention or the same sort of service or level of service from some of the larger service providers that have the greater global footprint and the greater capability. But the needs of that type of sponsor differ very much from the very large pharma with a much larger infrastructure and their own ability to have more global outreach or more technology solutions.